Hi, class. It's Dr. Lindner. What we're going to be doing here in this next set of videos is going to be the cardiovascular system. Now, I have a separate class and videos on the heart. I have a separate one on the blood. Let's take a look at the blood vessels. When you study blood vessels, it's really important to kind of get a visual in your head of the flow. And in order to get that down, there really is no easy way except getting a blank sheet of paper and start writing in a linear fashion the flow. That's really it. And you have to do it several times. And then in your mind, as you're looking at the blood vessels as a whole, you can start pointing to the highways, if you would, right, to the transport vessels, the internal irrigation system. And you can follow them and say, okay, this is going away from the heart. We know these are arteries. Let me see where it's going, what structures. Let's see if I can name it now based on the anatomical locations for the most part. And then, all right, these are going to the heart. So these are veins, right? Arteries always send blood vessels away, and veins send blood vessels towards, with the exception of the pulmonary artery and veins. They're flip-flopped. They're opposites. So you really do, this involves a little bit of work in terms of, pausing and drawing things out, or looking at some worksheet that actually have the blood vessels, and then, without the answers there, start filling them in. Okay, so we're going to address this in terms of the arterial system first, which go from the heart and branch outwards, and then we'll address it by the venous system, which are pooling blood back into the heart. Okay, that's the way we'll split it up. So let's look at the cardiovascular system in terms of the heart, review a little bit quickly of the heart and lung connection. So let me get my pen here, my marker. So we have a pulmonary circuit, which is the arteries and veins that transport between the heart and the lungs. And then we have a systemic circuit. Just think of the systems, right? It's the arteries and veins that transport blood from the heart to the rest of the body. So here's the pulmonary circuit. Let's take a look here. If we start, it's good to start right here at that superior vena cava, and then at the bottom, the inferior vena cava. And then let's not forget, somewhere in here would be the opening or the orifice for the coronary sinus. This is where all the deoxygenated blood ends up in the right atrium. And then blood is pooled into the right ventricle. When the right ventricle contracts inferior to superior, right? The ventricles contract this way, inferior to superior. It's going to shut the tricuspid and push the blood up into the pulmonary semilunar. It's a push valve here. When that opens, blood goes in the pulmonary trunk into the pulmonary arteries. In this case, the arteries are blue because it's deoxygenated. These are deoxygenated. These arteries are pumping away from the heart into the lungs. The lungs pick up oxygen, and now it's driving oxygenated blood into the left atrium. Okay, and here's where we have our pulmonary veins. Pulmonary veins here are red. It's pumping blood into the heart. Arteries pump blood away from the heart. Veins bring it towards the heart. The only opposites are with the heart in terms of the color. Hopefully I didn't confuse you earlier on when I talked about opposites in the heart. It's opposite color when you look at the arteries and veins. When we look at arteries and veins in the periphery, you'll see arteries are always red and veins are always blue, with the exception it's opposite here. With the heart, we see the arteries are blue and the veins are red. Think of oxygenated versus deoxygenated. So the pulmonary veins bring the oxygenated blood to the left atrium, down into the left ventricle. Again, the left ventricle contracts inferior to superior, forcing the mitral valve shut and forcing open the aortic semilunar. And now we're pushing blood into the ascending aorta, into the aortic arch, and then down into the descending aorta. And from the descending aorta, it goes into the thoracic region, thoracic aorta. And then it's down into the abdominal region where you have the abdominal aorta. And then there are branches that lead to the lower extremity. And these three valves of the trumpet on top will bring oxygenated blood to the head and both extremities. So that's the general flow here. When all the oxygenated blood is delivered from the upper extremity, from the head and the arms, it has to find its way back into the superior vena cava. And then from the trunk and the lower extremities, it's got to find its way back into the inferior vena cava. Okay, so that being said, here's the general overview of the main arterial system, the main arteries, and everything on this slide is what you need to know. I could end it here. Okay, so we're going to break it up into different sections, right? We'll break it up into the head, then we'll break it up into the arm, and then we'll break it up into the trunk, and then we'll break it up into lower extremity, and this will help us understand it a little bit easier by breaking it down. So what's nice about this picture, you can see the heart, we can see the ascending aorta, we could see the arch of the aorta, and right off the arch of the aorta, there are three valves of the trumpet, three branches, one on the right side, meaning the individual's right side, not your reading right. There's one on the right side, one called the brachiocephalic trunk, and then there's two on the left side. There is a left common carotid, and then there is a, number three, a left subclavian artery. Okay, left common carotid artery, left subclavian artery. Those are the three valves of the trumpet off the arch of the aorta. The brachiocephalic, if you look at it, brachio means arm, cephalad means head. So from this artery alone, it's going to find a way to bring oxygenated blood to the head and to the right arm. On the left-hand side, we have the left subclavian, sub, under, clavicle, which means it's going to go under the clavicle and find its way to go down to the arm. Left common carotid, anything that has the word common, it is safe to assume that somewhere along its path, a common will divide into an internal and external something. Whenever you see the word common, it's safe to assume most of the time it will divide into an internal and external something. Okay, so those are the three. Going up into through the vertebral column in the cervical spine, we have a vertebral artery. We have a right common carotid. Now, the right common carotid is coming off of the brachiocephalic, right? It's going to lead, and it's part of this cephalic portion on the right-hand side. Okay, what else do we have? Here's the pulmonary trunk from the heart. If we look at the left subclavian, artery, it will lead into the axillary artery, which is in the armpit. Then if we follow the axillary down, it's going to come down into the arm, eventually become the brachial artery, which we see on the reading left. And then that brachial artery will divide into a radial and ulnar. Easy enough, radial and ulnar arteries, it follows the radial and ulnar bone. And in the palm, we have palmar arches. There's a superficial and deep palmar arch. Okay, here's a diaphragm. In the trunk, right here in the abdominal region, I should say, we have this celiac trunk right here, and that's really important. We'll focus on that too. 3 blood vessels that come off that celiac trunk. And in the abdominal region, going to the kidneys, We have the renal going to the gonads, whether it's the testes of the ovaries, it's the gonadals. And then going to part of the small intestine and part of the colon is the superior mesenteric. And then also going to the second half of the colon is the inferior mesenterics. Here's the descending aorta. And then for the lower half, if you look at the bottom portion, we have the common iliacs. Again, what did I say? Anything that has the word common, it's safe to assume it will divide into an internal and an external something. So the common iliacs will divide into an internal and external iliac artery. All right, so those are the main ones. Then when we follow down off of the common iliacs, eventually it will lead to the femoral artery in the thigh. The femoral artery kind of goes posterior. The femoral artery leads into the popliteal artery, also on the posterior. That popliteal artery kind of squeezes in between the fibula and the tibia to the front to become the anterior tibial artery. Okay. On the posterior side, if there's an anterior tibial artery, there will be a posterior tibial. And in front, kind of between the first and second toe, there's a dorsal pedal artery, and it's a good place to kind of take the pulse of the lower extremity. If circulation is poor down here, especially in men, you'll see little hair on the lower portion. If pulses are really bad, there's no popliteal and a weak femoral pulse, then most likely there's ED or erectile dysfunction. So once that blood is kind of delivered, then it has to find its way into the venous system. And the venous system, when we address it, will you have to keep in mind that it starts at the distal portion. So it's going to work from the fingers, find its way into the heart. It'll go starting at the head, find its way into the heart. It will find its way from the abdominal region into the inferior vena cava, into the heart, and from the lower extremity, from the feet, all the way up into the inferior vena cava, into the heart. But we'll, just to align your thinking with the arterial system, we're starting with the heart, and then we branch out and away. When we talk about the venous system, it's finding our way back into the heart. Okay, so that is kind of like that, a pretty general overview. So let's look at the main blood vessels that come off the heart. There's an ascending aorta, there's an aortic arch, and then remember, off the aortic arch, there's 1, 2, 3 arteries that come off of it. I call them the 3 valves of the trumpet. The brachiocephalic is on the right side, and obviously these two are going to be on the left side. The brachiocephalic, in the word, we see cephalic, which means head. We see brachio, meaning arm. So from the brachial division, that will lead into the arm, because it leads into the right subclavian, and the cephalic portion will lead into the head, into the right common carotid. And then the right common, anything with the word common, will divide into an internal and external carotid artery. So on the lower right is that flow chart that you can kind of rewrite. On the top right, we're showing, on the top here, we're showing the ascending aorta. Then we have the aortic arch. Then we have the brachiocephalic trunk, right? So it's from that brachiocephalic that we're going to have the right subclavian and the right common carotid that come off of it. So here's the right common carotid, and here's the right subclavian artery. Okay, so now if we take a closer look, here again is the ascending aorta. Here's the aortic arch. Here's the brachiocephalic trunk coming off to the right. Now, off the brachiocephalic, here is where we're going to have the right common carotid artery. And from that common carotid, that will divide into two vessels, right? Anything with common, internal and external carotid artery. Internal is going to feed in the brain and external will stay externally. Off of the brachiocephalic, we also have a vertebral artery that's going to go through the transverse foramen of the cervical vertebrae. Both the vertebral arteries and the internal carotid arteries are going to help make up the blood supply into the brain. We will go over something referred to as the circle of Willis. That helps to bring blood into the brain. It's so important that the brain has two ways of getting blood into it, the vertebral arteries and the internal carotids. Okay, off the brachiocephalic, we now have the right subclavian under the clavicle. Once you're in the armpit, it just changes name to become the axilla, right? In the armpit, axillary artery, right axillary artery. You should always name these by name, right? If it's the right side, it's the right subclavian artery. If it's on the right, it's the right axillary artery. You want to get into that habit of incorporating the left and right. I think that's a very important concept. The axillary artery comes down the arm into the brachial artery. And then as we move down into the forearm, following the radius is the radial artery, following the ulnar is the ulnar artery. In this picture, just pay attention. We're going to get to it shortly. If we look after the aortic arch, we can kind of see that it starts to descend. So this portion, although it's not labeled, it's the descending aorta. So let's see, right here would be the descending aorta. When you're in the thoracic region, thoracic aorta. And then when you're in the abdominal region, it's the abdominal aorta. Okay, so if I've mentioned it, it's important. Once we're in that forearm, here's the radial artery, here's the ulnar artery, and then it's going to bring the oxygenated blood into the palm, and we're going to have a superficial palmar arch and a deep palmar arch. Okay, and then from the palmar arches, we have the digital arteries. Okay, those are the main vessels that I'd like for you to review of the upper extremity. When we come back, we're going to get into blood supply into the brain.